In this video, we'll be doing more infection control questions. This is part 3. There's been a part 1 and part 2. We will be going over vaccines, immunizations, concepts of immunity. There will be 5 questions. I will read the question to you, then we'll pause to let you think for a second. Then I will read the options and we'll discuss why the answer is best. If you need more information on these topics, you should be able to find that in your nursing resources under immunizations, infection control, foundations, fundamentals, and maybe even in your pediatrics chapters. They talk about vaccinations a lot there too. Let's get started. Question number 1. A nurse is assigned to care for a client with active chickenpox. The nurse is concerned because she has an unvaccinated newborn at home and asks the charge nurse to change her assignment. What should the charge nurse do? Should the charge nurse do number 1, change the nurse's assignment? Number 2, ask the nurse if she is immune to varicella. Number 3, ask the nurse if she has received her MMR vaccination. Or number 4, tell the nurse her newborn cannot catch chickenpox. And the answer here is number 2. What we should do here is to assess first. We need to know whether the nurse is immune to chickenpox or not, and chickenpox is varicella zoster. And so in the further learning, if the nurse is immune, meaning the nurse has either been vaccinated for varicella or had chickenpox in the past, then she should not be able to catch and spread the varicella, which is chickenpox, to her newborn. So you need to think of vaccines as shields. Except for the COVID vaccine, the vaccines in the immunization schedule protect against infection. The chances of getting that infection are slim to none. And so in this case, if the nurse is immune, we wouldn't have to change her assignment. If the nurse wasn't immune, she shouldn't really have that patient anyway. You shouldn't give the chickenpox patient to a nurse that doesn't have immunity. Question number 2. A nurse is doing a well baby check on a 6-month-old. The nurse expects to give which immunizations? Select all that apply. Is the answer number 1, the MMR, number 2, DTaP, number 3, Hib, number 4, varicella. And this is just your knowledge of the immunization chart. The answers are number 2 and 3. And instead of trying to spend a lot of time memorizing that thing, because it's pretty impossible, the easier way to do it is just to remind yourself that you are not allowed to give live vaccines for any children under 12 months old. And so in the further learning, if you knew the immunization hint down here, that the only live vaccinations on the immunization table right now are MMR and varicella. And therefore, those vaccines cannot be given to any children under 12 months because it could actually make them sick because they are live. And in the same way, if you see in the immunization hint, you can also remember that for the questions on which vaccines can pregnant women get. It's not that the pregnant woman can't get the vaccine, it's that it will harm the baby in utero. So just remember, any baby 12 months old, or I'm sorry, younger than 12 months old, even the baby in the belly, no live vaccines. No MMR, no varicella. And therefore, pick the ones that aren't either one of those, and you should get these answers right. Number 3. A mother brings her sick 2-year-old child into the clinic. The mother states the child has had a fever of 102.7 for 2 days. Upon assessment, the nurse notes bluish-gray spots in the child's mouth. What should the nurse do next? Would you do number 1, to notify the doctor? Number 2, ask the mother what the child has eaten recently. Number 3, check the child's pedal pulses. Number 4, ask if the child has received the MMR vaccination. And the answer here is number 4. Even though we have some objective data in the question, the fever and the bluish-gray spots, hopefully those bluish-gray spots seem a little odd to you, and anytime we see something odd, maybe it's because they haven't had a vaccination. So we need to continue to assess here. And so the thought is just to assess further by asking about the vaccination status. If you did know that those bluish gray kind of white spots in the mouth are called Koplik spots and are a sign of measles or rubeola, you would have had an advantage in this question. And in the picture, there's a picture of Koplik spots there. So in the further learning, it is a good idea when you're studying these pediatric immunizations to also know what those diseases present like so that you can catch it in a child that might not have gotten that vaccine. Number 4, the nurse is developing a health risk assessment protocol for use in a well baby clinic in a low-income neighborhood. Which information is most important for the nurse to include in the assessment? Would you want to know about number 1, hearing acuity, number 2, immunization history, number 3, weight and length, or number 4, head circumference? And the answer here is number 2. The clue here is that you are developing a health risk assessment, and it does say most important. We have to remember that the child that doesn't get the vaccines is most at risk for basically fatality, for disease. And in the further learning, when you see that word most important, you have to remember Maslow, and Maslow says that priority is the highest risk of physical, fatal, fastest. So basically, what would harm the body the quickest? And so weight and length might have pulled you a little bit here, but it would take a while to have big problems due to like weight. However, catching disease, that could hurt you a lot faster. So that is why number 2 is the most important item to assess in determining somebody's health risk. Last question, number 5. A nurse is working on a pediatric unit. Which patient would the nurse assess first? Would you assess number 1, a child with strep throat that is crying, number 2, a 3-year-old with a urinary tract infection and a temperature of 101.5, number 3, a 2-year-old with pneumonia, or number 4, a newborn who needs a Hep B vaccine? And the answer here is number 2. When we're looking at who to see first, you should go for that patient that's showing you a sign or symptom, somebody you might need to assess and intervene for. So if you didn't like number 2 because you maybe expected a fever and a UTI, we don't know if that's why they have a fever. Maybe it's another reason. And would we just let a patient have a fever? Wouldn't you want to go take care of them? So nobody else has a sign or symptom. The pneumonia it doesn't say it's symptomatic, so I'm not going to make it symptomatic. Strep throat, they're crying. They're not showing like a physical change right now. And then the client that just needs a Hep B vaccine, that's just a task. There's no change in that newborn that needs you to go in there right now and assess them. So in the further learning, remember Maslow priority, just like we said in number 4, says the physical is first. And in patients, how do we know they have physical issues? Is because they have changes in their condition, which means they're showing us signs and symptoms. So always try to look for those patients in your options. So that's it for this video on immunizations and vaccinations and just the concepts around immunity. If you enjoyed these questions and critically thinking, subscribe to this channel for more videos like this. And please don't forget to like our video, and you can always find us at sciencestrategies.com.